and a pleasure to serve under your chairmanship, and I congratulate my honourable friend for securing this debate on such an important matter, as he says, of life and death. An issue that I have no doubt will draw agreement from all political parties, and such is the nature of the honourable member for Strangford, being one of the few members who could rightly be called my honourable friend by all sides of the House. Vitally important, Mr Hollybone, that there is greater access to defibrillators in local communities across the whole of the UK. And just to save myself tripping over the word defibrillators for the next 5 minutes, I'll shorten to defibs from this point on. Every year in Wales, around 6,000 people suffer from cardiac arrest, with around half of these occurring out of hospital and just 1 in 20 surviving. The National Institute for Health Research has found that survival outcomes for people experiencing out-of-hospital cardiac arrest is greatly improved when bystanders use a defib. So, when considering a patient's chance of surviving, as the Honourable Lady mentioned in her intervention earlier, decreases by at least 10 to 15% with every passing minute, it is extremely vital that everyone in the community not only knows where the nearest defib is located, but also, most crucially, that they have the knowledge on how to use it and the confidence to even try. Now, I understand just how important it is to ensure the education of these life-saving skills is improved, having campaigned with the family and friends of Janine Maguire, a loving mother of 3 who unexpectedly passed away of a cardiac arrest in February 2000. Sadly, and almost amazingly, nearly 2 decades later, one of Janine's daughters also suffered from a sudden cardiac arrest, yet fortunately was with her friend who saved her life by performing CPR until a paramedic arrived. The experience of that family in my constituency really highlighted to me the importance of improving awareness and knowledge, both of CPR and of access to defibs. And I'm pleased to say that as a result of our campaigning, the Welsh Government did indeed commit to including life-saving skills in the curriculum in Wales, as it was previously included in England. So hopefully, by equipping young people with the knowledge to save lives, we can ensure a survival rate of out-of-hospital cardiac arrests is greatly improved. Despite the success of having added to the curriculum in Wales, the campaign for improving life-saving skills and access to equipment is certainly far from over, as both access to defibs and the knowledge on how to use them is still greatly to be improved. As part of my commitment to improving these skills, I'll continue to work with Welsh charity Calon Hearts in the new year to organise a number of CPR events in my constituency, where participants are able to learn the skills and the confidence in order to apply them, to ensure that people from all backgrounds have the knowledge so that they too are able to save lives. But although the Resuscitation Council has provided guidance for adult basic life support, which advises on how CPR and defibrillation should be administered during a sudden cardiac arrest, the vast majority of people still don't have that knowledge and are unable to utilise it when needed. There are currently 5,423 public access defibs registered with the Welsh Ambulance Service, yet the British Heart Foundation estimates that there are in fact thousands more that the Welsh Ambulance Service doesn't have any record of at all. So, with this in mind, it seems like an obvious but important point to make. What's the point in increasing the number of public access defibs if people don't know where they are and don't know how to use them? So, there seems to be a simple solution to the issue. Why can't we have a comprehensive UK-wide database on an app that can be downloaded on smartphones and ensure that it includes every single defib, their precise locations, and simple, easy-to-follow instructions on how to use them? It seems like a relatively simple database to establish and maintain, and shouldn't be beyond the wit of man to put something in place along those lines. There are already a number of different defib databases covering different areas of the UK, so it's certainly a feasible idea, especially as much of the data is already there and just needs amalgamating into one comprehensive place. So if all of the respective NHS systems throughout the UK just work together with organisations like Circuit, the National Defib Network, then this could be easily achieved and would undoubtedly help to save many more lives. The Welsh Government, to their credit, has recently committed £500,000 in funding to improving community access to defibs, so I'd encourage them to consider collaborating with the UK Government and indeed the Scottish and Northern Irish devolved administrations as well, to ensure that public access to defibs and the knowledge on how to use them can be improved across the UK, as well as making it mandatory for all defib providers to register every new device on the database. Every second counts when someone goes into cardiac arrest. and I want to make sure that as many tragic and unnecessary deaths can be avoided by equipping the general public with as much knowledge and as many skills as possible.
Richard Thompson.